Welcome back, future orthodontist. Today we enter the world of treatment planning, the stage where all your diagnoses and assessments come together to form a roadmap for your patient's perfect smile. A treatment plan has several key components: the problem list, treatment objectives, growth assessment, extraction versus non-extraction decisions, Anchorage planning, and appliance selection. Let's break them down. First, the problem list. Every treatment plan starts here. Ask yourself, what are the skeletal issues, dental issues, functional problems, and aesthetic concerns? Used in mnemonic SFAD: skeletal, functional, aesthetic, dental. Always check all four areas before planning. Examples include Class 2 skeletal discrepancy, crossbite, excessive overjet, crowding, or spacing. Next, define the treatment objectives. Objectives are the destination on your roadmap. Key goals are achieving functional occlusion, improving facial aesthetics, ensuring stability of results, and minimizing the risk of relapse. Growth assessment is crucial, especially in young patients. Used in mnemonic AGE. Assess growth early. Check chronological age, skeletal age, and pubertal growth spurt. Growth influences treatment timing, appliance choice, and extraction decisions. Deciding whether to extract teeth is one of the most debated aspects of treatment planning. Consider the mnemonic CPP: crowding, proclination, profile. Severe crowding or proclined teeth may require extraction, and profile considerations help maintain aesthetics. Anchorage planning is next. Anchorage is the resistance to unwanted tooth movement. Plan how to control tooth movement using intraoral appliances, extraoral devices like headgear, or TADs, temporary anchorage devices. Use the mnemonic AAA: anchorage always accurate. Good anchorage ensures predictable treatment results. Finally, appliance selection. Choose appliances based on age, type of malocclusion, skeletal versus dental problem, and patient compliance. Options include removable, fixed, functional, or combinations with TADs or surgical adjuncts. To summarize, the essentials of treatment planning are problem list, SFAD, skeletal, functional, aesthetic, dental; objectives, function, aesthetics, stability, relapse prevention; growth, AGE, assess growth early; extraction decision, CPP, crowding, proclination, profile; anchorage, AAA, anchorage always accurate; appliance selection, choose based on age, malocclusion, and compliance. Time for a quiz. Question 1. What does SFAD stand for? Question 2. When should growth be assessed? Question 3. Which factors guide extraction decisions? Question 4. What does the AAA mnemonic remind you to plan? Great work! You now know how to design a complete orthodontic treatment plan. See you in the next video on developing dentition management.